Hello, and welcome to the Clinical Liver Disease video series. CLD is an official digital learning publication of the ASLD. I am Ruben Hernaez, transplant hepatologist at the Michael E. DeBakey VA Medical Center in Houston, Texas, and one of the authors of the Management and Depression and Anxiety in Patients with Chronic Liver Disease, publishing in an upcoming issue of CLD. I'm here with my co-authors, Dr. Keila Carrera-Mejias, Research Assistant at UT Southwestern in Dallas, Texas, and Dr. Mauro Garcia-Altieri, Transplant Psychiatrist at the Michael E. DeBakey VA Medical Center in Houston as well. Mauro, why is so important the screening for depression and anxiety in patients with chronic liver disease?
Hello, everyone. Thank you for this opportunity. It is extremely important to screen patients for depression and anxiety symptomatology. Number one, because it's highly prevalent. A big portion of this patient population do suffer from these symptoms in these chronic medical disease states, particularly chronic liver disease. Number two, it increases the morbidity. When patients have the mood, depressive symptomatology, and anxiety. And these symptoms directly and indirectly affect many of the medical outcomes, including behavioral-related ones, compliance, etc. And that will obviously impact your direct desired outcomes. Number three, it clearly decreases the quality of life and the functional capacity of these individuals. So it is extremely important to screen these individuals on a regular basis in terms of which patients we need to and which patient population is in high risk. Patients with obviously pre-existing psychiatric history or previous depressive or anxiety episodes with increasing psychosocial stressors or according to the different etiologies of the medical of the liver disease. We need to pay attention to those individuals.
Thank you.
Oh, great. Dr. Garcia, how can we differentiate between an over hepatic encephalopathy versus depression and anxiety symptoms?
A very important question and very relevant in this particular population. Hepatic encephalopathy can have a very wide variety of manifestations. As any delirious or encephalopathic process, according to the different nosology, these are acute or subacute alterations in one, alertness, two, attention. So every time we have individuals that have these changes and fluctuations in each of them, we need to think of an encephalopathic process is going on. We can obviously do formal screenings, like utilizing screening tools like the Folstein Minimental, the MoCA. If we do not have the time and or the skill to perform those, we can still do some bedside or clinical tools like counting, listing, spelling backwards, or serial subtractions in a way that it tests specifically for the attention or that level of alertness. So again, reiterating, if it is an encephalopathic process, we're going to have these acute, subacute changes and fluctuations, whereas if it is a primary idiopathic psychiatric disorder, whether it's depression or anxiety, it won't be as fluctuating. It will be more of a pervasive nature. So we think of something that is more longitudinal. So that is a very useful clinical tool that we have to pay attention when evaluating these individuals.
Thank you, Mario. Quite interesting. So along the same lines, how often do you think we should screen for depression and anxiety in patients with chronic liver diseases?
Well, as we clearly reiterate in the article, these disorders are quite prevalent, high prevalent in our population. So therefore, there should be routinely incorporated into our clinical practices. We talk about some of the differences in screening tools that we can incorporate into our clinical practice. So I would say at least in a yearly basis. However, if there are more acute or subacute clinical changes in the presentation, in the history, regarding psychosocial stressors or something like that, we can and should do it even more often than that as possible.
Excellent. And finally, Dr. Garcia, once the patient is screening positive in our clinic, what therapy can we offer to this patient while the patient is waiting for a psychiatrist consult?
Very good question. I think the article alludes to some of the current clinical practice and current clinical scenario, which basically means that there is a significant discrepancy between the demand and the access. So therefore, as a psychiatrist and working in integrated settings, we need our counterparts. We need you as a gastroenterologist and a hepatologist to be heavily embedded in this holistic approach of our patients. Number one, we you don't have to be a formally trained psychotherapist to be able to do psychotherapeutically informed interventions. Empathy goes a long way, developing rapport goes a long way. So that's obviously extremely helpful in navigating individuals with chronic distress. In part of the way that we're developing different types of models, like collaborative care model, integrated care model, there are usually care managers or behavioral specialists working with primary care physicians, primary care teams, and some specialty teams that they can help with doing some evidence-based interventions as well. So working in collaboration with our peers is going to be extremely important. Before we're able to get them connected as needed, doing the step care approach with formal psychotherapeutical interventions like cognitive behavioral therapy, acceptance and commitment therapy, and other evidence-based interventions. We also talk a little bit in the article about some of the psychopharmacological interventions that we can use for these individuals when we have clearly primary psychiatric disorders or secondary neuropsychiatric manifestations of the liver disease. So we can definitely get ourselves informed and do these interventions when needed.
Dear Mauro, thank you so very much for highlighting the clinical importance of the prevalence and management of anxiety and depression in our patients with cirrhosis. Well, on behalf of all of us on the CLD team, I hope you found this video useful. And for more information about chronic liver disease and depression and anxiety, please visit us at www.cldllearning.com. And thank you very much for watching.